Hi, so today I will be exploring the effects of mental health and the COVID-19 pandemic on the ongoing opioid crisis in America. Um, so, to start, an overview of the opioid crisis. So, in 2019, over 50,000 Americans died from an opioid overdose. An opioid can be classified as anything from pain meds to fentanyl. It's kind of a spectrum. The opioid crisis has cost America $78.5 billion a year, in anything from like healthcare costs to lost productivity, as well as treatment for addiction, and then also the Justice Department costs that go along with this ongoing crisis. And that's not to mention the cost of incarceration and housing prisoners, especially with the high sentences that drug crimes can carry. These prisoners tend to be incarcerated for a long amount of time. And the opioid use in America has more than quadrupled over the past 15 years. So this crisis is growing really quickly. One question that's important to ask is, how did this happen? How did it get so bad? And pharmaceutical companies actually lied to doctors and consumers about how addictive these opioid meds were so that they could prescribe more of them. They claimed that they were completely safe and without risks, and so doctors went on and prescribed them without worry, and patients took them without worry, and they very quickly became addicted. 8% of the patients who consumed these medications developed an addiction to them. So that's a pretty high number, along with 4 to 6 of these patients turning to heroin after the drugs that they were introduced to their addiction become too hard to access or too expensive for them to afford. And 80% of heroin addicts have actually started with or have abused prescription drug medications in the past. And then obviously addiction is dependent on the longevity of a person's use, and then also the level of intensity of the prescription that they're given. So mental health and addiction are very closely tied. 18% of American adults use opioids, and 51% of this 18% of Americans deal with mental health issues. So there's obviously a very strong correlation between these two factors. People who struggle with mental health issues can be up to 13% more likely to abuse opioids at some point in their lives than those of us that don't struggle with mental health issues. The 16% of Americans that do struggle with mental health issues receive more than half of the opioid medications that are prescribed in the country. So not only is mental health very closely tied to addiction, but it's actually very closely tied to specifically opioid addiction in the country. So the COVID-19 pandemic also plays into this. 4 in 10 adults actually reported feeling anxious or depressed during the lockdown, and then the subsequent international quarantine that went on. And this is compared to only 1 in 10 adults reporting these symptoms just a year earlier. So this number really spiked over the COVID lockdown. 12% of adults reported increased substance use during the pandemic. And this substance abuse included, something as simple as a glass of wine with dinner more often to relying on heroin to get through the day. So not all of this substance abuse is directly tied to the opioid crisis, but some of it is, and it definitely jumped during the pandemic. So the opioid crisis and COVID-19, it's Michael Barnett, a doctor, has said that it was very much like twin pandemics colliding. We went into the COVID-19 pandemic with an already failing public health system and an already ongoing crisis, and we were just hit with more. The stress of the pandemic created the perfect environment for addiction to flourish, especially the isolation associated with COVID. In addition to existing addicts turning to drugs to cope, or recovered addicts relapsing. Individuals that have struggled with chronic pain ended up turning to hard drugs as a cheap option to manage pain. And this was for a couple reasons. I mean, it was harder to get doctor's appointments. It's harder to get into the hospital. Drugs are more expensive. Supply lines are messed up. It was just more difficult to get anything during COVID. So if you're struggling with chronic pain, you would turn to anything to take that away. And opioid users actually experience pulmonary and respiratory health issues, which is important to understand because that makes them more susceptible to COVID-19. So not only are these people struggling mentally and falling back on their addictions, they're also injuring their chances of remaining healthy during the pandemic. And what you can do to combat addiction and the effects of COVID on all of us, and how that ties into mental health and how you can make sure that you don't fall subject to the opioid crisis. The most important thing is to take care of yourself. The best way to help the crisis is to stop it from ever starting. If each American makes sure that they never fall into the trap of drug addiction, no Americans would be addicted to drugs. And while that's easier said than done, a huge part of this is taking care of your mental health. Prioritize yourself, eating well, drinking water, getting exercise. And that's not, a one-size-fits-all solution, but there's simple steps that can really greatly affect your mood and your mental health. Another thing you can do is donate and volunteer. So you can donate to local organizations combating the opioid crisis and help those that are addicted. You can volunteer your time for these same organizations if you feel compelled. And another key thing that you can do is participate in your neighborhood drug take-back programs. Most local neighborhoods have these, or local governments will put them on. Getting unused prescription meds out of your house and in the garbage can stop those closest from you from slipping into addiction. You never know who's going to open up the medicine chest and just don't have anything in there to find. And don't forget that anyone can fall victim to addiction. It won't happen to me attitude can't be tolerated. We have to find a way to fight this crisis, and that starts with ourselves. And lastly, just make sure that you're educated. The strongest weapon that we have is information. Keep yourself informed so you can spot the signs of addiction and you can help yourself and those around you. And it's really the most important parts of, making sure that this doesn't ever become something that's affected your life. So that is all. Thank you very much for listening.